Good afternoon, friends. Today we are discussing about non-steroid anti-inflammatory drugs. As the name suggests, they are not steroid. It means they are not glucocorticoids. Anti-inflammatory means they are especially used to treat inflammations. So these are the groups of drugs that prevents inflammation. That we use this type of drugs as a symptomatic therapy. They are not used to treat underlying pathological reason. So we will not treating disease, actually we are just removing the symptoms. Like if you have pain, we give NSAIDs, the pain will be removed, but the cause will not be removed, that is causing the pain. Just have a look at the mechanism of action of non-steroid anti-inflammatory drugs. In cell membrane there are fatty acids, and this fatty acids is metabolized into arachidonic acid by phospholipase. C. This is the enzyme where our glucocorticoids acts. Our glucocorticoids blocks these enzymes and prevent all of these cycles to happen. But this NSAIDs, it blocks in another step, like it blocks our cyclooxygenase. So arachidonic acid, it will be either metabolized through cyclooxygenase pathway into these products, or metabolized through lipoxygenase pathway into these products. Our NSAIDs blocks this one, cyclooxygenase, and it will prevent the formation of prostaglandin S2, which is the precursor molecule for our prostaglandin I2 daba, prostaglandin E1 into F2 alpha thromboxane A2. Now I'll talk about some physiological effect of prostaglandin I2. This prostaglandin I2 is also called prostacyclin, and it is secreted by your endothelium. The inner lining of blood vessels, they are called endothelium. It secretes prostaglandin I2, and this one is very effective vasodilator and anti-aggregant. But in contrary to this thromboxane A2 is just opposite of prostaglandin I2. This one is produced by thrombocytes, and it is pro-aggregant, so it helps in aggregation and addition of platelets, plus it is a powerful vasoconstrictor. And this E1 into F2 alpha, they increase sensitivity of pain receptors, they relax smooth muscles fibers, they play with your thermoregulatory center, and so on. And this some words about lipoxygenase pathway. We will find leukotriene A4, and it will either form leukotriene B4, which is a powerful chemotactic agent, and C4D4 leukotriene C4D4 E3 E4, they are also called cysteine leukotrienes, and they are a very potent, powerful bronchoconstrictors. So this is the mechanism of non-steroid anti-inflammatory drugs. It blocks this enzyme cyclooxygenase, and thus prevents formation of thromboxane, prostaglandin E1 E2 F2 alpha, and here lies its anti-inflammatory effect. So I am now discussing about chief effects of what? Thromboxane, NSAIDs. NSAIDs, it has got many effects, but as the name stated, is the number one effect is anti-inflammatory. Why? Because it is blocking the production of prostaglandin, which is a inflammatory mediators. And another effect is also antipyretic, means they are supposed to reduce temperature. How they reduce temperature? Because again here they are blocking the formation of prostaglandin E1. Prostaglandin E1 and E2, they are endogenous pyrogenic molecule. They plays with the hypothalamus thermoregulatory system and set a new point. So by blocking the production of this thing, they are not causing fever, they are stopping the fever to happen. Number 3, it is what? Anti pain, yani analgesic. Why analgesic? Here also, because they reduce the formation of prostaglandin. And prostaglandin, what does prostaglandin do? Prostaglandin makes your pain receptors, means make your free nerves endings sensitive, much more sensitive for histamine, bradykinin, for pain mediators. So it itself is not a pain mediator, but it makes receptor more sensible for the pain mediators. And not all, but few, especially aspirin, when you use it in small dose, it has also got anti-aggregant, because here why it acts as anti-aggregant, especially aspirin, because it blocks the formation of thromboxane A2, and I told you thromboxane A2 is a powerful vasoconstrictor. Thromboxane A2 is a powerful proaggregants. Okay, now some classifications of NSAIDs depending upon this SOC 1 and 2. I should tell you SOC 1, cyclooxygenase 1, this one is physiological, and SOC 2 is inducible. So it happens only when there is inflammation. This ferment is active only when there is some pathology or there is some inflammation, and this cyclooxygenase 1 is normally active. It is a physiological. Through this way we form prostaglandin I2 A2, and through this we form prostaglandin, which are mediators for pain, for fever, like this. And some drugs block only cyclooxygenase 1, some drugs, most of the drugs block both cyclooxygenase 1 and 2. Some drugs particularly more predominantly SOC 2, and some very selectively cyclooxygenase 2. Number 1, what are the drugs that block cyclooxygenase 1 only? It is aspirin, when you use in low dose aspirin. Number 2, those drugs who blocks both cyclooxygenase 1 and 2. They are most of the drugs, most of NSAIDs like ibuprofen, ketorolac, diclofenac, indomethacin,